In the meantime, we'll see whether or not Congress, well, we know it has not yet passed health care reform legislation. That is not keeping the state of Arizona from making a move to opt out of it entirely. Have you heard about this? Nancy Barto is a state Republican representative out of Arizona. She serves on the Health and Human Services Committee, and she's been up all night trying to get the votes together. Good morning to you out there in Phoenix. Do I have this right? You want to get a constitutional amendment in your state that would enable the citizens of your state to opt out of any national health care reform that may come out of Washington. Is that what you're going for?
Yes, it certainly is. And the measure passed both houses of the state legislature a couple of weeks ago, and it's on its way to the ballot. All the Republicans voted for it, and unfortunately every Democrat opposed it. But what it will do is it will protect patients' health care decisions, giving them the option to opt out of whatever mandate comes out of Washington as far as a government-controlled health care plan. It also will guarantee patients' right to purchase health care and receive health care.
Well, you want to get this done by 2010, which is about a year away. What are you afraid of that comes out of Washington? What's your big fear? I mean, well, why take a measure like this?
Well, I've been asked that a lot. Why be so proactive when we don't know what's coming? Well, we see the signs, and they all lead towards one conclusion, that government is heading in the direction of a huge takeover of your health care decisions. So we are being proactive to protect our citizens' rights. What we're seeing is really a monumental takeover. I'm one of 1,800 state legislator members of the American Legislative Exchange Council, and last month, ALEC members passed a resolution that invoked the 10th Amendment to the U.S. Constitution, calling what's coming out of Congress a takeover of our health care system.
Well, here's what the White House is saying.
Which really is not in our enumerated powers.
I understand your position. I want to get it out so we can discuss this further. The Obama administration is saying this. They are insisting now that the public option, if provided through the health care reform, will just give more choice for Americans, and making Americans have better latitude with their own health care insurance. Also, they're saying for those who are not happy with their current insurance, well, you're going to have another option. The other thing they say is it'll force these private companies to be more competitive. Now, that's 3 points coming out of the White House. What's wrong with that?
They're wrong on all 3 points. Certainly, what they're saying, I think they believe will be true. That Americans will have a choice. But whenever government gets into the business of healthcare or becomes a competitor, they change the rules to win. Government can't be a competitor and a regulator at the same time. It doesn't make sense. Sooner or later, and probably sooner, citizens won't have a choice. For one thing, they will drive the private insurers out of business, and employers that currently carry their employee health insurance will drop it because of the lower cost government options,
well, it is,
adding 119 million more people onto the rolls almost immediately.
You're in Arizona. 5 other states are considering something similar to this: Indiana, Minnesota, New Mexico, North Dakota, Wyoming. They're not nearly as advanced as you are. I'm out of time, but the constitutional amendment under state law, it would have to go before voters, right, at some point next year to get it done? Do you have the votes to get it through?
Yes, it will. Well, it's already gone through the legislature. It will be on the ballot, and I believe it'll pass overwhelmingly.
Wow. Nancy Barto, it is a groundbreaking move by the legislature in Phoenix, Arizona. Thank you for sharing that with our viewers this morning. We'll watch it from here in New York, okay? Thank you.
My pleasure. Thank you.
All right, Megan, what's coming up next?